Uganda have over 2 million conceptions every year, and between 200 to 400,000 of these women miscarry or abort spontaneously. The study also shows that some 350,000 abortions are induced. This puts the life of such women at risk and contributes to the 438 deaths of women during child labor for every 100,000 of them. Health activists with legal background at this forum, organized by the Center for Health, Human Rights and Development, are calling for the amendment of the Penal Code to address some of the major challenges linked to abortion-related complications.
That is why we are proposing that in terms of trying to make reforms, there are three proposals that are being made. One is to amend the Penal Code. Two is to amend the Public Health Act. And three is to enact an entirely new law under Article 22.2.
The Ministry of Health could be making attempts to address maternal health challenges, but health experts say abortion has been neglected, yet it's a critical component of reproductive health.
Hindrance has been the fact that the health professionals are finding it difficult to provide the service. They actually don't know the limit of what they can give. Because as you can see from the constitutional perspective, the constitution is very broad and it leaves it to the law to actually spell out the circumstances under which the service can be provided. Unfortunately, we don't seem to be having very good clarity on that.
Charles Sengwena of the Center for Human Rights in South Africa argues that there are many gaps in the present legal frameworks like the Penal Code and the Constitution of Uganda.
Women are able to rely on human rights, but through the instrument of the Constitution. That is really the answer.
And to me, my opinion is that we need now to move forward, say, except authorized by law, and then work on the law. No more work on the law, give those circumstances where termination is acceptable.
According to Article 22, Clause 2 of the Constitution, the termination of the life of an unborn child can be legalized under special circumstances. But since 1995, when the Constitution was promulgated, Parliament has not passed an enabling law. So, a number of women and girls are having illegal abortions under risky circumstances. State Minister for Health and General Duties, Sarah Opendi, recently kicked off a storm when she called for the legalization of abortion.
We have a policy in place. The legal sector is still lagging behind.
For me, the question then becomes, as Professor Ngwena rightly surfaced, the question about values. What are our values as a society among the global community of nations? What were the values we espoused in 1995 in the Constitution?
There are guidelines, but you are also aware that there are also laws, and you are aware that laws, of course, take precedence over guidelines unless the guidelines are based on, the guidelines and policies are based on that law. So what's the current law is the issue.
Apparently, the Uganda Law Reform Commission is moving to review the Penal Code with focus on abortion. These activists are asking for either a new law on abortion in the Penal Code to remove the general criminalization on procuring a miscarriage, or a new law to specifically address the circumstances under which the life of an unborn child may be terminated. Zahra Namuli, Walugembe Josephat, NBS Television.